Hello once again and welcome back to my YouTube channel. Today I am going to continue what we have started with regards to the pain and management for the back issues. Just so crazy, I keep on forgetting what I'm going to say. But um, let's just go ahead and, get on with it. Hello once again and welcome back to my YouTube channel. I am Alotte and I am a physical therapist. In today's video, I am going to continue the next part of the series for management of back pain and neck pain. Last week, was it last week? Or the last video that I posted, we are talking about how bad posture could cause you pain on the neck, on the back, shoulder, and also even going towards the legs. So today I am going to continue and show you some of the exercises that we can do in order to in order to kind of open up the chest area and strengthening the back area in order to maintain that more upright posture. So if you're new to this channel, please consider subscribing, as most of the videos that I am posting is part of the series, so you will not miss any videos, and hit the notification bell so you would be of course you will be notified. That is so crazy. Anyway, where am I? Okay, let's go and start this thing. Okay, now to the other exercises that we can do, especially when you are working at the desk or pretty much like you are confined into more on the sitting posture. Okay, so I am going to move this to the side so you would see it properly. Now this is what we call the chin tuck. The never-ending chin tuck that we keep on teaching our patients, but most of the time it's being done incorrectly. Okay, and just go. Okay, so what does chin tucks mean is that you're just gonna push your head a little bit more towards the back. Usually patients will go this, which is not the chin tuck, but a head extension. Okay, what you're gonna do is pretty much like keep your eye a little bit straight forward. Okay, body more upright. Then you can put your hand here. What you're going to do is just keep your shoulder a little bit push more towards the back, push your head a little bit more towards the back. Okay, so it's just your head from here. If I just exaggerate it, it's like from here, forwarded posture to the back. See the difference? This one here to the back rather than this one here that way. There's a huge difference. Okay, so you're gonna start with just, no holding, probably 10 sets, and then 10 times, 1 to 2 sets. Now, I am gonna advise to some people who have a temporal mandibular joint pain, because this may be painful for you. Okay, because as we move that head back, it kind of like affects as well the joint here. Okay, all right, so that's what you mean by chin tucks. Now if you combine chin tucks plus head extension, then you could go from here and then you go up. Okay, and back. Again, you push back your head and then head extension. Now, what does it target for? These are the muscles that I talked to you about from here, the suboccipital muscles. There's like a little bit of tightness in there, so we're just gonna like target those muscles on the suboccipital areas. Okay. Now the next one, when you feel like it's already a little bit more loose, this may take some time, okay? And you probably may feel soreness as well. Now, mind you, when you're doing the exercises, soreness is probably good because you're just awakening those muscles that has been not used for quite some time or gets tight for quite some time. But if it's like painful, that probably you need to like reduce the repetitions. You might be like pushing it too much, especially pain that goes towards your arms, because that potentially may be a nerve, or worse if there's like numbness or cold feeling, because that might be a blood vessel. So a little bit more careful when you are doing these exercises. Okay. Now the next one is from the shoulder rounded posture. We are going to make sure that we are opening the chest and the front. Okay, what you're going to do first is just to roll your shoulder and to the midline, shoulder to the back and to the midline. Again, shoulder to the back and then the midline. Okay, that's potentially be like your pectoralis minor, that we are gonna like mobilize at first because we're still not holding. The pectoralis minor is part of the chest. It's like this chesty muscles in here. That's a smaller one under that big chest muscle. And that muscle potentially could compress nerve. That gives you that abnormal sensation towards your hand. Okay, so you can do it again. Just roll your shoulder towards the back. Roll your shoulder towards the back. Okay, now the next one is we are going to target that muscle in between the shoulder blades. So if this is your shoulder blades, that muscle that is connecting that to the spine. Okay, so it's pretty much like here and here. And we call that muscle rhomboids. Probably there's a little bit more in the middle trapezius as well. But here's what we're gonna do. I'm gonna scoot towards the edge. And then you're just gonna incorporate the shoulder roll towards the back and then squeeze that blade. So the blades is like you're approximating it towards the spine. Imagine that there's a dollar in it that you're trying to like hold up. Okay? So let's do it again. Roll. Probably would show you the back. You probably may not see it, but you're just gonna roll the shoulder back and then squeeze your shoulder blades. Again, roll the shoulder back and then squeeze. Okay? One more time. Roll the shoulder back and then squeeze. So you could feel that bones in here going towards each other. Okay? Those are the first 3 exercises that you can do while you are even like working. You know, on your breaks, that could easily be incorporated during your day, especially if you're not doing anything. If you're just staying in the house and you're doing nothing, might as well do something like that rather than it's like, I'm sure not everyone is doing it, but I'm sure everyone is be like marathoning Netflix, whatever it is, because we're in pandemic. Everyone is inside their houses, so a lot of those times that could be those are the times that usually people get pain because of that long-standing faulty posture. So start with that exercises first in the pelvis, you know, and then push your head towards the back, roll the shoulder, squeeze the blades. Okay, but you're not gonna be like walking like this. That is just to strengthen your the muscle that is responsible for doing that, so that when you're not consciously addressing and making your posture upright, the muscle is strong enough to pull your shoulder back and also to make sure that your pelvis is in there. Okay, so we're just doing more the muscles from here in the neck and a little bit more on the upper back. Okay, all right, so we'll see you again next time, and this will be a continuation of some of the exercises again in order to address poor posture. So please don't forget to subscribe so you will receive that notification of that next video. Okay, bye for now.